Good afternoon and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. First, some of the highlights. Today, Channels Television launches its COVID-19 monitoring dashboard, giving latest information on coronavirus cases in Nigeria. Presidential Task Force on COVID-19 give detailed guidelines on how places of worship could reopen. And Italy opens its borders to Europe without quarantine. Now here is the launch of the Channels TV COVID-19 monitoring dashboard. It's a portal that gives you daily updates on the coronavirus cases in Nigeria. Now, the catch here is that we'll be bringing you information at the local government level and not just, the state. So, and joining me here right now with regards to the figures and what we need to know is our health correspondent, Yomi Otagwe. You've been behind the figures.
Yes.
You've been cooking a lot of figures.
Millicent, I'm very excited to be here because, information is power. And when you have this information, it's going to help you make informed decisions. So we have the COVID-19 case monitoring dashboard, the Channels TV COVID-19 case monitoring dashboard, and it will give you all of the figures that you need to know. Real time as it's happening.
A lot of people are wondering, how is this different from what we know? The Johns Hopkins Response COVID-19 Center, the NCDC portal as well.
Okay, so let me take it from the NCDC angle. When you go to the NCDC website, you find the national figures. You find for the states as we have it, you find the confirmed cases, the total numbers, you find the active cases, you find, recovered cases, which we also have here. But the catch here is that we also have for the local government areas, particularly the top 10, top 5 that you can see and, be able to say, okay, so this is my local government. I know, okay, in this particular area, we have, this number of cases. What can I do to protect myself, better? What can also the state government, also do that? Okay, in this area, if we can go to Lagos State, for instance, you find that the total case that we have here already on the national figure is 5,277. But if you go, down to the breakdown of the local government by local government, you find, cases, for instance, in Lagos Island, Lagos mainland, Etiosa. You want to know which of the local government areas, have the highest and the lowest figures. So we have the first one, we have Lagos mainland. Lagos mainland figures, it's over 1,000 as we speak. So if you live in that area, you want to think, okay, so we have more of these cases here. What can I do to protect myself? What can I do to protect my, loved ones? And how better can I, take on all of these precautionary measures that government have been talking about, wash your hands, use your face mask, don't touch, high areas, that we have. When you touch, a lot of people touch you. You also don't want to touch those
Let's not forget also that the PTF has told us that of the 774 local government areas across the country, we're looking at 20 densely populated with regards to where community transmission is seeing at its highest. Yes, and then Lagos has how much?
Lagos, so of the 20, Lagos alone has 12. So 12 of the local government areas, we have 20 local government areas in Lagos, plus, of course, the 37 local council development areas. But of the 20 local government areas, we have 12 nationally. So, when we say Lagos is the epicenter, we mean Lagos is the epicenter. So you have mainland having the highest.
Yes.
There you have it.
The figures
mainland.
Right now. Lagos mainland, 1,274 cases.
And followed by Mushi, Etiosa, Alimosho, Koshofe. I think the lowest is Ojo local government area. So if you look at some of these figures, you are able to decide and say, okay, so this is what we have. And it will also help the government at every level, at the state, local government, to know that, okay, so we have this much figures here. How do we go about, contact tracing in this kind of areas? What message do we carve out for those people in those areas for them to know that this is serious? Not, of course, we are not saying the other areas who don't, have that much figures should go to sleep. Right. No, but you're able to put in more effort in these areas and say, okay, if you come to Channels TV COVID-19 case monitoring dashboard, you are going to get all of this. You have the top five states. So you have Lagos, you have Kano, you have
the FCT, Katsina,
you have
and the other
Katsina, and you know, it varies like that. But you are able to get all of these figures at your fingertips.
All right, this is definitely a novel thing, and it's powered by SGL. We also have another partnership with regards to the Channels Television, talking about the monitoring dashboard. It's also important that we're also seeing these figures you know, at a time like this. And many of course, our viewers can indeed access all of this information on our website.
Yes,
that's
so
channelstv.com.
if you go to channelstv.com, you can now, you know, click on the link to the Channels TV COVID-19 case monitoring dashboard.
All right, it's really interesting. I'm sure we'll be having you more often to tell us about, indeed, some of these figures that are coming in, and I hope that is user-friendly.
And maybe I should also use this opportunity, you know, to talk to the state governments. You know, these figures are very important because sometimes you find it difficult even to get, you know, some of those figures out of the state's ministries of health. And, you know, these figures are important just so everybody is on the same page. So when we come to you for those figures, please give us some time.
All right, thank you so much, Imo State, for joining us.
Thank you.
All right, over in Benue State, which currently has 9 cases of COVID-19, 8 cases are active, and then we have 1 discharge case. The state government introduced some measures to keep COVID-19 at bay, but in some areas, the level of non-compliance to safety measures, especially the closure of markets, is being violated. The Commissioner for Health and Secretary to the State Action Committee on COVID-19, Dr. Sunday Ongbabo, re-emphasized the need for residents to imbibe safety protocols, which are clearly being violated at the Wadata market. But in Benue, a civil society group, Save Nigeria movement, they've raised alarm over lapses on the part of the Nigerian Center for Disease Control, NCDC, in the area of testing methods and procedure. They say the lack of attention to severe cases of malaria and Lassa fever is claiming more lives than COVID-19.
The immediate reaction of many Nigerians to the NCDC's midnight nightmare of increasing cases is that the agency now has a panic button it uses to scare the citizens and governments of Nigeria, simply for selfish gains. If not, why then is the COVID-19 pandemic and its ancillaries the sole preoccupation of the NCDC, other than other public health bodies? Is it because it is currently the only disease which gives access to high, unbelievable sums of public funds, along with which billions from public sectors are also donated freely? This country is plagued by many other endemic diseases like Lassa fever, malaria, meningitis, etc., which kills eventually more than the COVID-19. We have had over 655 deaths from Lassa fever alone in the last few months in Nigeria. Malaria remains the highest killer of children in the world. Why are they ignored with mourning death stores? Why the COVID-19 is given all the attention? Is death by COVID-19 now some kind of allied death, more celebrated by the Nigerian Center for Disease Control? There is an apparent lack of synergy again between the Nigerian Center for Disease Control, which is at the center of managing this pandemic. This is glaring in the several altercations between the agency and officials of some state governments. Zamfara, Bauchi, Kwara, Rivers, Cross River, and Kogi states are the few that come immediately to mind.
And now to the agency tasked with protecting our health this period. The Nigeria Center for Disease Control, NCDC, have the total confirmed COVID-19 cases in Nigeria at 10,819, with the announcement of 241 new infections last night. The number of patients discharged has risen to 239, while the death toll is now 314. Of the new cases recorded in 13 states and the FCT, Lagos has 142, Oyo 15, the FCT 13, Kano 12, Edo 11, Delta 10, Kaduna and Rivers 9 each, Borno 8, Jigawa 4, Gombe and Plateau 3 each, Osun and Bauchi have 1 each. Lagos in the southwest still has the highest number in the country and the southwest region with 5,277 cases, followed by Kano in the northwest with 970 cases. The FCT in the north central region maintains the third highest tally in the country with 687 cases. In the northwest, we have Borno, the highest figure at 296. Edo in the south-south with 336, while Ebonyi leads in the southeast with 40 cases. Remember that recently the executive director of the NDDC passed on. Now we're being told that he died of COVID-19. This is after the family authorized the commission to announce that the late executive director tested positive to the coronavirus. Mr. Banga Basiatang passed away in the early hours of Thursday, May 28, 2020. The River State Ministry of Health had written to the Niger Delta Development Commission, NDDC, to also confirm the cause of death resulting from complications attributable to the coronavirus. And the ministry has since directed the commission to order all management staff to go into self-isolation for a period of 14 days with effect from today, while seeking the cooperation of the organization in tracing staff and contractors who might have had close contact with the deceased. And following the federal government's announcement on the relaxation of the ban placed on places of worship across the country, the Presidential Task Force on COVID-19 has released some protocols that will guide the reopening of religious places. Now, first is that all places of worship must sign up to full compliance with all aspects of non-pharmaceutical interventions to protect people from COVID-19, including but not limited to the mandatory use of the face mask by worshippers, hand washing with wash spots at the entrances of all worship places, hand sanitizers, at least 60% alcohol content, and not forgetting temperature checks as well. Facilities are also to be structured in such a way that physical distancing is observed. Worshippers are advised not to touch each other in a manner such as hugging, shaking. Churches, mosque volunteers that have underlying illnesses are not allowed to serve. Also, the time for worship services should not be more than 1 hour. It's been said that there can be intervals of 30 minutes, which there can be break to disinfect and for people to also wash their hands, and before another service is allowed to start. Mosques are to open 20 minutes before prayers and close 20 minutes after prayers. It's said that there should be no Islamia schools. Prayer sections should be staggered, no social gatherings before or after services. Also, business outlets at worship centers are to remain closed. The elderly above 55 are advised to observe worship services at home. It's also important, according to the task force, that the churches and mosques improve their environmental hygiene. Windows should be left open during services, as it's more dangerous to hold services in enclosed air places. It's also advised that surfaces should be frequently cleaned. Worshippers with COVID-19 symptoms should not go to the places of worship. It's really a long list from the Presidential Task Force on COVID-19 and also the Nigeria Center for Disease Control. And these measures, if strictly adhered to, will protect you and your family as we fight the pandemic. Of course, our website, channelstv.com, you can take a look at the comprehensive list, keeping you safe as we get back to our normal lives. Still to come on the program, Professor Rosemary from the Nigeria Institute of Medical Research joins us on the program. Do stay with us. Welcome back. We bring you this latest update from Imo State. Our correspondent Itokpe Kuteye on the state's efforts to sensitize citizens against the coronavirus.
as Nigerians continue to adjust to the new guidelines and protocols rolled out by the Presidential Task Force on COVID-19 regarding the second phase of easing the lockdown. The National Orientation Agency in Imo State is taking a step further to create awareness on these new guidelines by organizing a motorized enlightenment campaign to educate Imo indigents on taking seriously the measures put in place by the government to contain the spread of the coronavirus disease in this second phase, even as the number of coronavirus cases keeps increasing by the day in the country.
We are to meet with the stakeholders, including the religious leaders, the traditional rulers, the market leaders, and the members of the National Union of Road Transport Workers. Why? Because we want to enlighten them on this new protocol for easing down. For instance, the banks, they've been told to be operating the normal working hours. The religious bodies you mentioned, there are some guidelines. Yes, they have been asked to go for their worship. But under that, you must wear your face mask for you to enter the church. They must observe social distancing in their pews. They must place water and soap where people will wash their hands, as well as sanitizers.
As it stands now, Imo State has recorded 39 confirmed cases of the coronavirus disease with only 4 active cases. And out of these 4, 1 is set to be discharged after testing negative to a recent test conducted. From Owerri, the Imo State capital, Eyitope Kuteyi, for COVID-19 updates.
Well, the realities are the implementation of these non-pharmaceutical interventions across the country. But as the world races to find a cure for the novel coronavirus, new science is emerging. But how can Nigeria change our response? Professor of Virology, Rosemary, a Director of Research from the Nigeria Institute of Medical Research, joins us on the program. Glad you could join us today.
It's a pleasure. Thank you.
So what have we found out? We've heard that coronavirus is novel. But what have we found out from what we used to know about the virus when it first emerged?
Well, the virus, we have characterized the virus, and we have been monitoring that. We know that the virus is highly infectious, and the strains that we are finding now, we are finding some slight mutations, which also indicates that it's also increasing its transmissibility. You know, so it's highly infectious, and it's still, and I mean, that is just the main thing, that it's still not, it has not reduced in that yet. Instead, it's becoming more and more infectious.
So in the case where we're having a higher percentage of asymptomatic patients, could one have COVID-19 and not know that they have COVID-19?
We have high percentage of asymptomatic patients, about 80% asymptomatic. Yes, there are many people who are infected that do not know that they are infected.
And then do they need to go for medical care, or can it just resolve itself along the way?
Yes. It can resolve itself, okay? So there are many people already in the community who are infected, and they are not aware they are infected, okay? And even amongst those who are tested, who have the opportunity of being tested, a good number of them don't even have symptoms. Even in the hospital, some do not have any symptom, they're just there. Okay, so that's why Lagos State has adopted this home isolation. Okay, so if someone is tested and is positive and there are no symptoms, that individual could be at home, self-isolate himself for 14 days, and that will be it. But there are a few people who have mild symptoms, and sometimes it could be severe. But people who have underlying conditions and the elderly necessarily have to be in the hospital for isolation.
All right, so what new thing is NIMA doing as the international community is rallying for support in science and research on this?
Okay, for NIMA, the support we have been providing for this COVID pandemic, we had this modified drive-through testing center where people come and they are tested, and their samples are collected and are tested. What we discovered is that the number of people that subscribe or request for this test through our website is overwhelming. We're unable to meet up with that, test all of them. Okay, so we have partnered right now with another organization such that we'll be able to provide do-it-yourself testing, meaning that you could collect your sample yourself. So this happens by, first of all, log into the website, and if you choose to do the testing yourself, the organization will contact you, and they will also inform us in NEMA. A rider will take all the testing kits to the individual. There'll be a video that you can see how samples should be collected. You collect it yourself and then send it back to us through the rider. We get it tested and the results are sent electronically. And there's an advantage in that we'll be able to cater for many more who are unable to come to our site. And then also, it will also reduce the contact between the testers and the clients.
All right. Is this at any cost?
No, it's free. It's free. This was just launched yesterday.
All right. We appreciate your time. We'd like to thank you, Professor of Virology, Rosemary Aldu, Director Research at NIMA. Thank you for joining us on the program.
It's a pleasure.
Well, as Europe gradually eases lockdowns and restrictions, Italy has reopened its borders to tourists from the European cities. Tourism is vital for Italy's economy, but had come to a complete standstill during the coronavirus pandemic.
After 3 months under lockdown, Italy has reopened its borders and ended travel restrictions between regions, hoping to encourage tourists back in time for the summer. The country was the first in Europe hit hard by the outbreak and has recorded more than 33,000 deaths. Meanwhile, Germany says it will lift a travel ban for European Union member states plus Britain from June 15, as long as there are no entry bans or large-scale lockdowns in those countries. The country says it will also remove its general warning against travel to European countries. However, it will continue to advise against travel to Britain for as long as the UK government continues to demand a 14-day quarantine for new arrivals. Away from Europe, a South African court has found that some coronavirus lockdown regulations imposed by the government were unconstitutional and invalid. The judge picked out rules around funerals, informal workers, and amounts of exercise as irrational. India's coronavirus infections have crossed 200,000. The health ministry says a peak could still be weeks away in the world's second most populous country. Cases jumped to 8,909 over the previous day in one of the highest single-day spikes in the country.
Take responsibility in protecting your health, the message from the NCDC. The website has all of the information, statistics, cases across states, regular updates on the COVID-19 regulations, and also the guidelines. From the World Health Organization, you can find the coronavirus disease situation dashboard. It's an interactive map. It provides the latest global numbers on a daily basis. And not forget our website, channelstv.com. It will take you to the Channels TV COVID-19 case portal. It's at your fingertips. You can see the updates, also updated figures by local government areas across the country on the pandemic. You can also find other information, news from Africa and also around the world. That's our COVID-19 update. Thank you for watching. I'm Millicent Wonka. Stay safe, stay healthy.